actually thought I didn't want to do it because I saw how hard my father worked and he wasn't home a lot. So I actually thought, well, what else can I do, because I don't want to work that hard. But when it came down to it, I was always geared towards science and math and enjoyed that. I
was going to go into dental school, and I did go to dental school. I spent a year at Emory in dental school in 57, 58, and said, boy, this is not for me. Can't do it, can't do this every day. So I dropped out of dental school and decided to go into medical school at that time.
When I was in high school, I did some volunteer work in an emergency room, and seeing the men and women walking around in their white coats, it was just so much respect, and it seemed like they had some inside knowledge, that they knew things that other people didn't. And it was kind of like they were almost wizards, because they got to go to this special school and they got to use fancy equipment, and they learned a language that nobody else knew, and they had all this knowledge about people, and sometimes they could do things that were almost magical. And so I said, I want to be part of that. I want to be part of that fraternity and learn those things.
Well, growing up, I liked the outdoors, and I thought of either being a farmer or a forest ranger. But then while I was in high school, I got a job cleaning kennels for the local veterinarian, and that's how I got interested in medicine and went from there to going to medical school.
So the ability to impact people's lives in a meaningful way and to work with them in a role where you're teaching both your patients and also teaching your colleagues.
So I went into him and asked him, Dr. Redmond, and said, I'd like to have a reference, if you would, for this program. And he said, well, what do you want to do? And I said, well, I want to get my PhD and teach. And he said to me, I'd been with him for almost 2 years. He said to me, no, you don't.
I think that the most stressful aspect would have probably been the hours were a little long on OBGYN, but outside of that, it was a lot of fun.
I remember us being in the anatomy lab, and I remember it was like a group of 3 or 4 of us that were good friends, and we were in there studying, and I just remember we just couldn't understand this one part of the anatomy that we had to learn for the test. And it was like, you're tired because you've been studying, you've been working all day, and we all just like broke down and started crying. And I just remember that as one of the days where we were like, what's happening to us? What are we doing?
I had to meet with the academic status committee while I was at UF, and that could be stressful in and of itself.
It was just time. It was just finding hours in the day to get all my studying done and also pursue a social life. And sometimes I pursued the social life a little too much.
I thought med school was fun. I don't think there was a hard. To me, there wasn't a hard part.
The first 6 weeks were terrible. The professors seemed to know what I didn't know and would put it on the exams. I couldn't catch a break. I really didn't know if I was going to make it. But after that 6 weeks, they learned what I knew, and they made their tests a little better, and I started to do very well.
I think the disposable needles and syringes were a great improvement for everybody. The needles were sharp, no barbs. The syringes worked, so something as simple as that, which we take for granted today, was making everybody's life easier.
The first technology, I would hate to say it's a recessa Annie. I would say we're probably a little bit above that. But the technology was a little more modest at that point in time.
Well, the use of the polysomnogram, which as a technologist at night working for Carajan and Williams, I would utilize.
When we were in anatomy, they gave us access to Dr. Rary's anatomy CD-ROM, and I actually still have a copy of that CD-ROM. And we would go on and we would do online reviews of the anatomy quizzes.
To look up papers in the library, we had to use these volumes of books called Index Medicus. And so we'd have to look up something, you have to go year by year and look up the same topic to find out if there had been papers written about that. And we thought it was amazing when they put that onto a CD-ROM.
You know, we had note service, right, and it was a tape recorder, and then we'd have an old typewriter, and I guess it was Farzan in our class. He had either a word processor or an early Commodore computer, and he was typing on this, and I just remember thinking, well, that's pretty cool. I don't know if that'll ever catch on.
Kind of like the horse and buggy area. We didn't have much technology. I remember I went to see a patient having a fluoroscopy. I thought, whoa, this is terrific. You know, I couldn't see anything. Things were going so fast.
Well, I certainly remember 9/11. I remember I was on pediatrics and we were doing rounds, and all of the patient rooms had the news, and they had the video of the first sort of plane going on. I vividly remember that.
There was Iran-Contra. I guess to this day I never really understood what that was. You just heard a lot of it.
Well, one of the events on our first week when we started was the Gainesville murders. And that was our first week of class. And the FBI is pulling students out of our class to go interview them, because the murderer was at one of the medical school parties and followed the first two victims home from the party.
We had the Cuban Missile Crisis. We watched the military coming right down. We'd sit there and eat breakfast in the morning and watch the troops rolling right down the street going down to South Florida. So we saw it going on, but again, didn't sink in how close everything really was.
When I would start doing the complete physical, I would start with the head, and they've got their gown on, and then I would listen to their lungs in the back where the gown was open. And with the girls, as I would take the gown down, I would ask them if anybody had ever taught them how to do breast self-exam. And as I was taking the gown down, I said, "Oh, you're Methodist." And she said, "How did you know?" And she had on a necklace with the cross and flame on it and had forgotten that. And of course, then she had a big laugh. And she said, "I thought you could look at my boobs and tell that I was Methodist." So she relaxed, and the rest of the exam was okay.
One of my colleagues, classmates, was a gunsmith and had made a cannon. And we went down to his house at Lake Wahlberg where he lived, and he shot off this cannon. And that somehow impressed me, with the cannon ball going through trees, going over the lake.
I had no idea that cystic fibrosis patients after the age of 18, they would continue to be cared for by their pediatrician because their intimate knowledge of the patient. So I walked into a room and I saw this young patient who was very, very thin, and I thought was a pediatric patient, but she was in her 20s, and she was sitting with a gentleman, probably, I don't know, in his late 20s, early 30s, and I said, "Oh, you know, this must be Dad." And that was not well received by the patient or her husband.
They tested us constantly. One of our last courses before we did our rotations was OB/GYN. And this one student was so frustrated, he went and wrote on the board. And when the instructor came in and started talking, I looked at the board and I broke up laughing. He meant to say, "No more tests, please." Instead, he said, "No more testes, please."
The laboratories smelled like formalin, and we all smelled like formalin. And oftentimes we would have the combination to get in so we could study at night. And so a group of guys played a prank, and they knew that one of their friends was coming in to study that night. So they took the body out, and one of the guys laid down in the lab and put the sheet over him. And when their friend came in, he came up like a zombie and scared him quite good. And everybody thought that was pretty funny. The twist to that story was that shortly thereafter that their cadaver wasn't there anymore, that it was removed. And so they said, well, why did you take away our body? And they said, oh, well, they found that one had a really rare infection that persists even despite the formalin. That was Creutzfeldt-Jakob disease. And they said, because they were laying in the same place that the body had been.
Every Friday afternoon, Cade, we'd all go down to Cade in the cellar. I mean, he was downstairs, and he'd have this big vat, and he'd have some lab alcohol in it and mix some juice in it. And he'd give a 10-minute lecture. Now, let me tell you, in that 10 minutes, you could learn more, because everything was very pointed, and everybody was listening because they knew what it was like Pavlov's dog, you know, if you listened, you got to drink out of the well.
We had a patient that was admitted for intractable hiccups. He had lost 30 pounds. He had been hospitalized several times in his hometown, had been anesthetized. All of his workup was negative. They couldn't find anything irritating his diaphragm. And we were scrubbed in, and Perry Berman was one of our classmates. He was somewhat gullible, and Wheat said, well, just give him some grape jelly. And Perry said, really? And he said, yeah. When he realized he was sucking it up, he poured it on. And so Perry went down to the cafeteria and got one of those little square packs of grape jelly and took it up and gave it to the guy and told him this would, if he just opened it and swallowed it whole, it would stop his hiccups. And it stopped his hiccups. And so the guy thought Perry was absolutely wonderful, and the information just flew around the hospital. They would come back occasionally and he would get a pack of grape jelly and down it would go. So Perry was a hero.
I had a wonderful experience, and under the same conditions, I would.
I would. I have to say, even though with all the changes in healthcare and everything, I have to say every morning I wake up and I enjoy coming to work.
Some of the best friends you'll ever make are in, in that period of your life. Going through med school, everyone's under the same stress, the same sort of learning curve. In a small sort of group of 150, 125 students. It's really a priceless experience. Some of my very best friends I still have to this day are from the class of 2003.
I'd go back in a minute. I love what I do. I love the way I was treated in the medical school complex.
Oh, unequivocally. No, I would, and I'd go to UF again. I'd go through the junior honors program. I have great memories of my classmates. We had, I think, great teachers.
I would, and I would hope that I would learn more. They say that we only learn about a third of what's presented to us, and so I think I would like to go again and maybe get another third, and maybe it would make me a better doctor.
I think Go Gators to me now would mean, I still think it's a great university. I think it's an absolutely fabulous university. I loved it.
It's a place you can be very proud of having your medical training. And certainly what they have given me that has carried through my career is critical.
Excellence, community, not taking yourself too seriously. Those are the kinds of things that come to mind for me.
I've been a Gator since we moved here in 1967.
You'll be off somewhere, you see the shirt, the Go Gators comes up, and you just have now kind of like an instant friend who's there, and a certain camaraderie that you have, which I think is pretty cool.
When somebody says that to me or I say that to somebody else, it means that we have something in common, and we have some common experiences, and we want to share that.
Gator Nation. I love seeing it everywhere. Wherever I go, when I wear a U of F hat or a shirt, people stop me, when did you go? I went here, I went there, I did this. Who did you know, who didn't you know? Terrific.